Hello, everyone. My name is Dr. Azaldin Ali, and I'm an associate professor at Florida Agricultural and Mechanical University, I'm at the College of Education, and at the Department of Health, Physical Education, and Recreation. And my topic today, or my research proposal, is about investigate and discover the reasons of sports joint injuries for student athletes and the mechanism for effective treatment. Again, the topic, it's about investigate and discover the reasons of the sports joint injury for those student athletes and finding a different mechanism which is more effective for treatment. And this research had the approval from the IRB committee, the Institutional Review Board, to implement the research. And a brief abstract about the topic, it's the impact of some joint injury, particularly injury for those soft tissues and the connective tissue surrounding the joints. And that kind of injury could last several months to a lifetime span for those student athletes. This proposed research also will investigate if there is a method to quickly and significantly strain or strengthen the soft tissues and rehab those sports-related joint injury. Our subject is about 15 to 25 students who participated at recreational sports at Florida A&M University. So they are into the soccer club, men and women, and also different recreational sports. And the findings also will determine the effectiveness of specific home exercise program that each athlete will receive. And the research team, including me and 3 certified athletic trainers, will evaluate the health improvement and the fitness level based on nutrition and training habits. Ultimately, this proposed study is intended to obtain the most efficient fitness regime that will keep the athletes healthier and stronger through their career. So I'm going to explain a little bit more about our subject, or our participants in this research. So they are more like student athletes, but into more like recreational sports. So they are involving into soccer activity, soccer club, flag football, also some other previous student athlete. They just recently graduate and they had a lot of experience in team sports and individual sports such as football, American football, softball, basketball, and volleyball. And we have only women volleyball at Florida A&M University, but we have men and women basketball, and also we have only the football team and the women softball team, and all the age group are 20 years and up. So this is mainly our subject, and all our subject, they had an experience of getting an injury before. So they had different injury, or some of them, they have 1 or 2 injury in their career. All the subject they will involve in 4 tests, and very simple. We have 4 pre and post test, and in between we're gonna have 6 weeks home exercise program. Before even we will run the pre and post test, so the students, they're gonna involve in very details and reply to a very detailed survey regarding their experience, the exact experience with the injury during their main career. Those students, they already done with competing for the undergraduate level, and they are not anymore under the umbrella of the NCAA rules. So we have a test or 4 tests, and then home exercise program, and then a detailed survey about their experience with getting injured. And then we will have 3 pre and post tests for our measurements and to collect data. And in between those 3 pre and post tests, the athletes will be provided with the HEP home exercise program, and then also we will give them some tools, light tools. So we're gonna draw for those drills for them, and the student athletes they're gonna use this 6 weeks program plus some type of exercise related to rubber band and resistance band. So exactly what kind of injury we are talking about in this research is mainly joint, like shoulder injury, knee injury, and elbow, and plus the surrounding soft tissue. So we have soft tissue, and then we're going to have a program, and then we will support the strengths of those soft tissue, and then we will figure out different mechanisms for treatment. So what are those tests so test number 1 is the whole overhead squat test, and it's a pre and post test, and the main goal of that test is to gain some knowledge about the level of their total body strength. And then test number 2, we're going to run some different range of motion test for the surrounding joints and the soft tissue, so we can get some really good understanding of the range of motion. We get to know some more about the flexations, the extensions, the abduction and the adductions and the rotation of those different joints, like the elbow, like the shoulder, like the knee, like the ankle. So this is very important test for the range of motion. And then test number 3, it's about the pain level, and we're going to use tools. We call it the Dolphin NeuroStim, and it's actually very affordable, and it's already in the market. And we're going to use the Dolphin NeuroStim, so we get to know more about the pain classification, and then later we will know how to manage that kind of pain or pain level. The test number 4, it's about stability and balance. So the athletes, they're gonna stand for 10 to 15 seconds. They're gonna keep their body in a streamlined position, and they want to stay steady for this period of time. And then that will give us an indicators about their stability and balance. And then after the pre-test, we will run 6 weeks program, and it's a very detailed program, and we will provide those athletes also with some information about diets and healthy habits, especially if they are continue training or if they have practice for their recreational sports. So we want to change the concept while they are performing their practice for those 6 weeks, plus the home exercise program. And then we will run the post test. But in the meantime, also during those 6 weeks, we will get some videotape, so we can keep those videotapes in our record, and then we can track a little bit their improvement. And then we will run an SPSS program. Then we can compare some means, and we will use some ANOVA test, so we can figure out the difference between the pre and post test, so we can get the final result for the experimental. We hope for a better or a different mechanism for the treatment. Then we can have a very effective treatment or different mechanism to deal with those joint injury. Thank you so much.